Does segregation cause health disparities? African Americans have a much higher death rate than any other racial or ethnic group. Black men have a life expectancy that is 7 years less than white men. Every 7 minutes, a Black person dies prematurely in the United States. These health disparities do not disappear as African Americans gain more education. African American mothers with college degrees are more likely than white, Latina, and Asian mothers with less than a high school education to have low birth weight babies. Whites who have graduated only from high school have a higher life expectancy than Blacks who have finished college. One reason Black people have relatively poor health outcomes is residential segregation. Segregation affects the educational opportunities of children, concentrates poverty, limits access to resources, and forces many African Americans to live in unhealthy environments. Segregation has adverse health outcomes for Black people because it creates unhealthy residential conditions, unsafe streets where people are scared to exercise, have few opportunities to buy fresh produce, see more advertisements for alcohol and tobacco, and live with higher rates of violent crime. Availability of healthy food is one way that segregation affects health outcomes. Researchers in New York City designed a study to find out which neighborhood stores carried foods that doctors recommend for people with diabetes. They surveyed stores to see if they had diet soda, low-fat milk, high-fiber bread, fresh fruit, and fresh vegetables. The study compared East Harlem, which is 6% white, to the Upper East Side, which is 84% white. East Harlem has the highest prevalence of diabetes and obesity in New York City, whereas the Upper East Side has the lowest prevalence. The researchers found that stores in the primarily white Upper East Side were 3 times as likely to carry all of the recommended food items as East Harlem stores. Across the country, Black people are more likely to live far from supermarkets with healthy produce and closer to fast food outlets and convenience stores. This contributes to higher obesity and diabetes rates for Black people. Black people are also more likely to live in areas where crime is higher, making it less safe to walk outside around their neighborhoods and difficult to get exercise. Because Blacks and whites live in segregated neighborhoods, they are served by different healthcare facilities. Hospitals in Black neighborhoods have fewer technological resources and less skilled physicians, which results in a failure to diagnose diseases correctly, missed opportunities for early intervention, and inadequate information about disease prevention. Black neighborhoods are also more likely to be located near toxic waste dumps and polluting facilities than white neighborhoods. By concentrating people of color into low-resource and high-crime neighborhoods, segregation contributes to poor health outcomes for Black people and creates racial disparities in health.